Bismillahirrahmanirrahim. Quote of the day. The Allah Rabbul Izzat said in Quran, if you are grateful, I will give you more. Assalamu alaikum everyone. My name is Dr. Marina Akhtar, PGR Community Medicine. Today my topic of presentation is gonorrhea. I am presenting this topic under the kind supervision of my professor Dr. Sair Afzal. Learning outlines, introduction of the topic, epidemiological triad, chain of transmission, level of prevention, recent advances, and the MCQs. Learning outcomes. By the end of this presentation, the participant would be able to describe gonorrhea, its epidemiological triad, its prevention, and recent advances. Case study. A 24-year-old male patient came to dermatology clinic, District Hospital ABC, complaining from severe burning sensation during urination and dysuria for 4 days. Additionally, he was suffering from penile discharge, testicular tenderness. He had a history of multiple heterosexual sexual relationships with last contact 8 days ago. On physical examination, vital signs showed blood pressure 110/79, pulse 75, temperature 37.6 degrees centigrade. There was mucopurulent cloudy discharge from urethra. Swollen testes were also observed. Following counseling urethral and ocular swabs, the blood samples were aseptically obtained and streaked immediately on thermartin and chocolate agar plates, then incubated overnight at 37 degrees centigrade at the presence of 5% carbon dioxide. Following the incubation period, grayish white transparent to opaque, slightly raised colonies with 1 to 2 mm diameter were observed. After gram staining, pink or red diplococci with coffee bean shaped cells opposing each other on concave sides. This result was sufficient for presumptive identification of Neisseria gonorrhea. What is gonorrhea? It is a bacterial infection caused by Neisseria gonorrhea that causes urogenital, anorectal, conjunctival, and pharyngeal infection. Urogenital tract infection are most common. It is second most frequently reported bacterial sexually transmitted infection (STI) after chlamydia trachomatis. Co-infection with Chlamydia trachomatis is common. Gonorrhea is also sometimes called scab or the drip. It is very common, especially among young people ages 15 to 24 years. Classification of gonorrhea. Type 1 is gonorrhea of urogenital organs, the genital. The second is extragenital gonorrhea, gonorrhea of mouth, rectum, pharynx, tonsils, and eyes. And third is metastatic, disseminated, complication of the first two types. Problem statement. Gonorrhea is sexually transmitted infection that remain a major public health concern. WHO estimate in 2020 there was 82.4 million, 47.7 million to 130.4 million new cases infected among adolescents and adults aged 15 to 49 years worldwide, with a global incidence rate of 1911 to 29 per thousand women and 2310 to 43 per thousand men. Most cases were in the WHO African region and Western Pacific region. Global overview. Prevalence among women are highest in the WHO African region 1.9% and the region of the Americans 0.9% and the Western Pacific region 0.9% and they were lowest in the European region 0.3%. Similarly, among men, prevalence was highest in the African region 1.6% and the American 0.8% and the Western Pacific 0.7% and the lowest in the Europe 0.3%. The incidence was highest in the WHO African region, the Americas, and Western Pacific and lowest in the European region. Epidemiological triad. Epidemiological triad includes host, agent, and environment. Agent. It is caused by gram-negative diplococci, gonococcus, Neisseria gonorrhea. it is shaped coffee beans, concave surface facing each other. Gonococcus, main pathogenic organism adapted to destroy mucous membrane covered with the columnar epithelium. In the patient body, gonococci often undergo L transformation that after using chemotherapeutic drugs. Natural host is the human. Environment. Organism is fragile and cannot survive outside the human host, affected by temperature changes, drying, UV light, and other environmental stressors. Organism cannot be transmitted from clothing, toilet seats, or household utensils to healthy person. Organism can affect any sexual active person even if they are healthy. Mode of transmission. Its source is human, root is sexual fluid, and target is healthy, susceptible person. It is transmitted through sexual contact with the penis, vagina, mouth, and anus of an infected person, and prenatally from mother to baby during childbirth. Incubation period is 1 to 14 days. Onset of symptom is 2 to 8 days. Risk factor of the gonococcal infection include in adults age younger than 25 years, black race, history of gonococcal infection or other STIs, inconsistent condom use, men who have sex with men, and new or multiple sex partners, prostitution, substance abuse. In children, mother with a history of STIs or substance abuse, mother without prenatal care and not receiving ophthalmic prophylaxis at birth, and sexual abuse. Pathogenesis, infection that cause attachment to the host cells, then corkscrew movement of the gonorrhea, and then they travel to lymph nodes that leads to in perivascular lymphatic uh, they move to perivascular lymphatics and cause endometritis obliterans that cause loss of the blood supply and genital ulcers. Clinical features. In men, it causes penile discharge, burning and painful urination, and in women, it causes vaginal discharge and burning and painful urination. And in men, it causes discharge, pain and swelling between thighs, inguinal region, and burning or painful urination. And in women, again, discharge, vaginal discharge, burning or painful urination, pain in the lower abdomen, abnormal bleeding from the vagina or anus. Infection in men with gonorrhea usually are symptomatic, but asymptomatic urethral infection may occur at least 10% of the cases. Common signs and symptoms include dysuria and purulent penile discharge. Unilateral epididymitis without discharge also may be present. Chlamydia cause 15 to 40% of the non-gonococcal urethritis cases in men. 1 to 2% of men who have non-gonococcal urethritis develop sexually acquired reactive arthritis. Infection in women. Untreated gonorrhea causes 10 to 20% of the PID, pelvic inflammatory disease, and 15% of the women with PID develop infertility from tubal scarring. CDC recommends that symptomatic women be examined for PID by palpating for cervical or adnexal tenderness and tested for gonorrhea, chlamydia, and bacterial vaginosis and trichomoniasis, and with endocervical swabs for light microscope and the nucleic acid amplification testing. Infection in infants. It can occur in the neonates from exposure to infected cervical secretions during delivery. Neonatal conjunctivitis treatment is important to prevent global perforation and blindness. And then it also can cause arthritis, pharyngitis, rhinitis, rarely pneumonia, vaginitis, urethritis, localized scabs, infection or abscesses, sepsis, and meningitis. Prenatal screening and the treatment of the pregnant woman for gonorrhea is the best method for preventing a new Neisseria gonorrhea infection among neonates. Disseminated infection. Disseminated gonococcal infection is rare, affecting 0.4 to 3% of the patient with gonorrhea. Examples are skin infection, tenosynovitis, and septic arthritis. A rare disease progression may result in perihepatitis, meningitis, endocarditis. Complications include PID, pelvic inflammatory disease, epididymitis that may lead to infertility, and disseminated gonococcal infection. Disseminated gonococcal infection is usually characterized by arthritis, tenosynovitis, and dermatitis. Level of prevention: primary, secondary, and tertiary. In primary prevention, there should be health promotion and specific protection. Health education: abstaining from sexual activity, increase condom use, increase sexual education, increase routine STI screening. Specific protection includes no currently licensed gonococcal vaccine exit. However, the interest in gonococcal vaccine development has been reinvigorated not only by marked increase in gonococcal antimicrobial resistance, but also by mounting the scientific data suggesting gonococcal vaccine are biologically feasible. And the secondary prevention includes early prognosis and prompt treatment. Uh, for the diagnosis, early testing is important for testing. Uh, for the test of gonorrhea, that include testing urine, gonorrhea culture may require endocervical and urethral swab specimens, and urethral for men or endocervical or vaginal for women specimen using nucleic acid amplification test NAT, most sensitive to detect urethral gonorrhea in asymptomatic men. If a person has had oral or anal sex, pharyngeal and or rectal swab specimen should be collected either for the culture or for NAT. Treatment: gonorrhea is treated with antibiotics. Treatment is recommended for a person who has positive gonorrhea test or anyone who has had sexual contact with a person past 60 days with a person diagnosed with gonorrhea, whether or not they have symptoms or used condom. Update to CDC treatment guidelines for gonococcal infection 2020. The summary: what is already known about the topic. Neisseria gonorrhea is important cause of sexually transmitted infection that can have severe reproductive health consequences. Neisseria gonorrhea can rapidly develop antibiotic resistance. Based on the review of the recent advanced, CDC recommend a single 500 mg IM dose of the ceftriaxone for uncomplicated gonorrhea. Treatment for co-infection with the chlamydia trachomatis with oral doxycycline 100 mg twice daily for 7 days should be administered with chlamydia infection has not been excluded. That is again summary of the treatment regime. Ceftriaxone 500 mg IM as a single dose for the person weighing less than 150 kg. And also there is given the alternative regime for uncomplicated gonococcal infection of the cervix, urethra, and rectum. If ceftriaxone is not available, gentamicin can be used 250 mg IM as a single dose plus azithromycin 2 gram orally as a single dose, and other alternatives. Recommended regimes for uncomplicated gonococcal infection of the pharynx: ceftriaxone 500 mg IM as a single dose of the person weighing less than 150 kg, and other alternatives are also given. HIV co-infection. Person who have gonorrhea and HIV infection should receive the same treatment regime as those who are HIV negative. Ophthalmia, neonatorium prevention and treatment. Recommended regime to prevent ophthalmia neonatorium caused by Neisseria gonorrhea include erythromycin 0.5% ophthalmic ointment in each eye in a single application at birth. Treatment of gonococcal ophthalmia neonatorium. Recommended regime for gonococcal ophthalmia neonatorium ceftriaxone 25 to 50 mg per kg body weight IV or IM as a single dose and not exceed to 250 mg. In pregnancy, pregnant women infected with Neisseria gonorrhea should be treated with ceftriaxone 500 mg in a single IM dose plus treatment for chlamydia if infection has not been excluded with cephalosporin allergy or other. Yeah. Antibiotic resistant Neisseria gonorrhea. What is antibiotic resistant gonorrhea? Antibiotic resistant AR is the ability of the bacteria to resist the effect of the drugs used to treat them. This means the bacteria are no longer killed by the drug that used to kill them before. The bacteria that cause gonorrhea has grown resistant to nearly every drug ever used to treat it, and it only matters for the time until it becomes resistant to the last available cure. CDC estimate that 1.6 million new gonorrhea infections occur each year and that half of those infections are resistant to at least one antibiotic. Gonorrhea has progressively developed resistance to antibiotic drugs prescribed to treat it. Following the spread of the gonococcal fluoroquinolones resistant, the cephalosporins antibiotic has been the foundation of recommended treatment for gonorrhea. The emergence of cephalosporin resistant gonorrhea would significantly complicate the ability of the provider to treat gonorrhea successfully since we have few antibiotic options left that are simple, well studied, well tolerated, and highly effective. It is crucial to continuously monitor antibiotic resistance in the Neisseria gonorrhea and encourage research and development of the new treatment regime. Causes of the resistance: unrestricted access to antimicrobials, inappropriate selection and overuse of antibiotics, poor quality antibiotics, genetic mutation within the organism has contributed to increased drug resistance in the Neisseria gonorrhea. Infection outside the genital area, namely the throat, rectum, particularly affect key populations such as men who have sex with men. This may also play an important role in the development of the resistant strains. Neisseria gonorrhea interact and exchange genetic material with other organisms in this part of the body. WHO response. WHO implementing the global action plan to control the spread and the impact of the antimicrobial resistance in the Neisseria gonorrhea to facilitate effective action against the spread of the multi-drug resistant Neisseria gonorrhea. This plan is the part of the greater STI surveillance plan to help early detection of emerging resistant strain, combined with the public health response to prevent and treat gonococcal infection and reduce the impact of the gonorrhea on sexual and reproductive health. The key WHO actions are effective prevention and control of gonococcal infection using prevention message and interaction and appropriate treatment regime, as establish effective drug regulation, strengthen surveillance system for antimicrobial resistance, especially in the countries with high burden of gonococcal infection, establish regional network of laboratories that can perform gonococcal culture with good quality control mechanism, monitor the treatment failure by developing a standard set of the protocol for monitoring, support for research to find low-cost tests to identify Neisseria gonorrhea and develop methods for detecting antimicrobial resistance, and research who alter into alternative treatment of the gonococcal infection. Screening. CDC recommend the yearly gonorrhea screening for all sexually active women younger than 25 years as well as older women with risk factors such as new or multiple sex partners or sex partner who has a sexually transmitted infections, and a routine screening for gonorrhea and other curable STIs should be performed at least annually in sexually active patients with HIV infection. Screening for urethral infection should be performed with urine nucleic acid amplification test And whereas the rectal or pharyngeal screening should be performed with nucleic acid amplification swab, screening every 3 to 6 months also is recommended for men who have sex with men if they have multiple, because they are at highest risk of contracting STIs. Uninfected pregnant women who remain at high risk should be tested during the third trimester. Gonorrhea by age in 2018, the highest rates among the females were observed among those with ages 20 to 24 years and 15 to 19 years. Among male, the rate was highest among those ages 20 to 24 years and 15 to 29 years. Gonorrhea by race and Hispanic ethnicity. The rate among the blacks was 7.7 times the rate among the whites. In Pakistan, National AIDS Control Program, the heterogeneity and interlinking of the high risk injecting and sexual behavior combining with low level of HIV knowledge and prevention and high level of other sexually transmitted infections. A few of the main objectives of the National AIDS Control Program are as under prevention of HIV transmission, safe blood transfusion, reduction of sexually transmitted disease transmission, and establishment of surveillance. Now coming to the recent updates. Multi-drug, or first article is multi-drug resistant gonorrhea, an emerging global threat. As we know, Neisseria gonorrhea is the bacterial culprit behind gonorrhea, a highly prevalent sexually transmitted infection found worldwide. Despite 1 million daily cases, many infections are asymptomatic, contributing to its widespread transmission. The emergence of multi-drug resistant strains poses a significant challenge to the public health, limiting treatment options and increasing risk of complications. And transmission primarily occur through sexual contact and bacterium thriving on mucous membrane in various parts of the body. Clinical presentation range from urethritis, cervicitis, where severe complications include pelvic inflammatory disease, disseminated gonococcal infection, laboratory. We also know about testing. Despite these challenges, there is the hope for the development of the treatment and vaccine. Promising candidates such as zoliflodacin and solithromycin has shown efficacy in clinical trials, while vaccine development faces obstacles due to bacterium antigenic variation. This paper undergo the urgent need for the continued research, surveillance, and development of the effective strategies to combat drug-resistant gonorrhea. Investment in the new treatment and vaccine is crucial to mitigate the spread of the infection and associated complications. Other article is systematic literature review and quantitative analysis of the health problem associated with sexually transmitted Neisseria gonorrhea infections. Neisseria gonorrhea infection has statistically significantly associated with preterm, premature rupture of the membrane, preterm birth, low birth weight, stillbirth, infant death, neonatal ophthalmia, schizophrenia in offspring, pelvic inflammatory disease, and substantial tubal infertility and human immunodeficiency virus and prostate cancer problems. Other articles is immune response to Neisseria gonorrhea and implication of the vaccine development. Protective immunity to infection is often not observed in the human, possibly due to high variability of the key antigen, induction of the blocking antibodies, or the large number of infections being relatively superficial and not inducing a strong immune response. Uh, the finding that the Neisseria meningitis serogroup B vaccine elicit cross protection against gonorrhea has invigorated in the gonococcal vaccine field, as there is More studies of the infection in the human, either natural infection or the controlled human infection. Model studies are needed to understand the better gonococcal protective immunity. Now coming to our MCQ session. MCQ number one is a 24-year-old male presented with dysuria and a yellowish urethral discharge for past 3 days. He denies any systemic symptom, but report unprotected sexual intercourse with a new partner 2 weeks ago. Gram stain of urethral discharge revealed intracellular gram negative diplococci. What is the most likely causative organism? Option A, E. coli. Option B, Neisseria gonorrhea. Option C, Chlamydia trachomatis. Option D, Treponema pallidum. Option E, Trichomonas vaginalis.
B.
Yes, B is the answer. MCQ number two is a 21-year-old male present with a painful swollen right knee. He denies any trauma but reports urethral discharge 1 week ago. Joint aspiration show purulent fluid and culture reveals Neisseria gonorrhea. What is the most likely diagnosis? Option A, septic arthritis. Option B, reactive arthritis. Option C, rheumatoid arthritis. Option D, gout. And option E, osteoarthritis.
A.
Yes, A is the right answer. MCQ number three is a 28-year-old male present with conjunctivitis, urethritis, and arthritis. He has a history of unprotected intercourse 4 weeks ago. Nucleic acid amplification test confirmed gonorrhea. Which of the following syndrome does this patient most likely have? Option A, Reiter syndrome. Option E, Fitz-Hugh syndrome. Option C, disseminated gonococcal infection. Option D, Steven-Johnson syndrome. Option E, Behcet syndrome disease. Behcet disease.
C.
Yes, C is the right answer.
C.
MCQ number four is a 3-year-old woman present with a lower abdominal pain, fever, mucopurulent cervical discharge. Her sexual history is significant for multiple partners. Which of the following complication is the most at risk of if left untreated? Option A, infertility. Option B, pyelonephritis. Option C, rectal fistula. Option D, renal failure. Option E, endocarditis.
A.
B.
A is the right answer. MCQ number five is a 28-year-old woman present with a severe pelvic pain, fever, irregular vaginal bleeding. On examination, she has cervical motion tenderness and adnexal tenderness. Her history is significant for untreated gonorrhea. What is the most likely complication she is experiencing? Option A, PID, pelvic inflammatory disease. Option B, endometriosis. Option C, ectopic pregnancy. Option D, ovarian torsion. Option E, appendicitis.
A.
A.
Yes, A is the right answer. MCQ number six is people with gonorrhea are commonly co-infected with chlamydia trachomatis. Which of the following is treatment regime for such patient as recommended by CDC? Option A, single IM dose of ceftriaxone. Option B, oral 500 mg ceftriaxone for 7 days. Option C, single IM ceftriaxone shot along with oral doxycycline for 7 days. Option D, single dose of both ceftriaxone and azithromycin. Option E, IV dose of gentamicin.
C.
C is the right answer.
C.
MCQ number seven is gonorrhea is treated with antibiotics. What problem has occurred recently in the treatment? Option A, antibiotic have in short supply. Option B, bacteria that cause gonorrhea have become resistant to certain antibiotics. Option B, they have developed an allergic reaction to certain antibiotics. Option D, intolerance and adverse reaction associated with antibiotics. Option E, antibiotics are expensive.
B.
B.
Yes, B is the right answer. MCQ number 8 is a 5-year-old neonate developed fever, irritability, poor feeding, blood culture reveal Neisseria gonorrhea. What is the most likely complication in his infant? Neonatal sepsis, neonatal meningitis, neonatal pneumonia, neonatal jaundice, neonatal encephalopathy.
B.
A.
Option A. Yes, option A is the right answer. A two-day-old infant developed swelling and erythema of the eyelids with purulent discharge. The mother was not screened for sexually transmitted infection during pregnancy. Which complications should be considered if infection extends beyond the conjunctiva? Option A, orbital cellulitis. Option B, retinal detachment. Option C, blindness. Option D, chronic decrositis. Option E, optic nerve hypoplasia.
A.
Option C, blindness. MCQ number 10 is CDC recommends yearly screening of sexually active women and pregnant ladies for gonorrhea and chlamydia. The highest incidence of gonorrhea happens in the age group. Option A, 6 to 14 years. Option B, 9 to 15 years. Option C, 15 to 24 years. Option E, 30 to 45 years. Option E, 50 to 65 years.
B.
Option C.
Yes, C. This is the key of our MCQs. This is the YouTube link of our channel where all presentations are uploaded. Kindly like and subscribe, and thank you.
Okay, Dr. Marina, very well presented.